The first thing you should do is to limit the amount of red meat that you consume. And yes, this includes pork. A lot of people don't think pork is red meat, but guys, it actually is. Pork is considered a form of livestock, along with veal and lamb and other foods. We think of beef and steak as red meat. Well, pork is too. You want to limit your red meat. The other thing you want to limit is your consumption of processed foods, things like deli meats, bologna, and other things, okay? Other ways to reduce your risk of colon cancer also includes eating plenty of whole grains and fiber. This is good and helps potentially reduce your risk of colon cancer. So make sure you get those whole grains in, that fiber as well. Also, maintain a healthy weight. Obesity and being overweight increases our risk for so many medical conditions and cancers, including colon cancer, believe it or not. So maintaining a healthy weight is super important. The other thing that's important for so many things is limiting our alcohol consumption. And to be honest with you, it's best if we don't drink at all, to be honest, in terms of the cancer front. But yes, certainly drinking only in moderation, but limiting your alcohol consumption is going to be very important, guys. We're talking about ways to lower your colon cancer risk. This is so important. It's something that we need to all be thinking about regardless of what age we are. And certainly if we have a family history of colon cancer or things like that, we need to be on higher alert. But the truth of the matter is we all need to be paying attention to our potential risk factors. All right, moving on. Other risk factors is getting exercise. Exercise is protective for a lot of things, right? Exercise is good for our heart. It's good for our bodies. It's good for our waistline. It's good for many things. It's also good for colon cancer risk reduction. So you want to make sure that you are exercising. Very important. The other thing is smoking. Now, look, smoking we know is not good. That is well established. Smoking puts us at risk for many things, lung cancer as well as many other conditions. Well, it also potentially puts us at risk for colon cancer too. If you don't smoke, please don't start. If you do smoke, please work on quitting, and don't be discouraged or get down on yourself if it's tough. Smoking is one of the hardest things my patients ever have to do. Be gentle with yourself, stay persistent, and get support in doing that. Talk to your doctor. The last and one of the most important things is to make sure we get screened. Getting screened is so important, guys. There are other potential ways we can lower our risk, but getting screened, what am I talking about? I'm talking about getting a colonoscopy, getting your Cologuard test. There's plenty of other screening methods available as well. But the most important thing is do not decline colon cancer screening. If you have concerns about a particular test, make sure you talk to your doctor about what the options are and if you qualify for other tests. But don't pass that up, and make sure you talk to your doctor early about when you should be screened for colon cancer. Remember, some people should be screened earlier than others. I have other videos on the warning signs of colon cancer as well as when you should be screened, so make sure you check those out. I'll put those in the description of this video. Guys, let me know how you're doing with these risk factors and how you try to stay healthy. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you've not liked and followed my page on Facebook, please do. For those of you who send stars, I respond to you personally. Thank you so much. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, check out my website, drjencaudle.com, for daily updates, daily health updates, my free health newsletter, and so much more.